You're going to come out here and go. Good afternoon, everyone. As we enter the 6 months since the U.S. first reported cases of COVID-19, the country has seen more than 3 million confirmed cases and over 130,000 deaths. Washington County saw our first confirmed case on March 21st, and since then, confirmed cases in the county have risen to 731, and sadly, 29 deaths. Overall, the age groups with the most cases are 20 to 29, 30 to 39, 40 to 49, and 50 to 59. These groups combined are 63% of our total cases. However, since the stay-at-home order was lifted on May 15th, our largest case growth is among those under the age of 30. Overall, the distribution by gender is 52% male and 48% female. 6 months ago, none of us could have imagined how our world and our lives would be thrown into turmoil by this new virus. The pandemic has brought out the best and the worst in humanity. All over the United States, we have seen heartwarming acts of resilience, inventiveness, solidarity, and kindness. But we have also seen concerning signs of stigma, misinformation, and divisiveness. Washington County's response to this public health emergency continues to be coordinated through the Emergency Operations Center. This group of dedicated professionals is committed to the health and safety of every resident of our county. The EOC is working in close coordination with the Maryland Department of Health, the Maryland Emergency Management Agency, Meritus Medical Center, and other state and federal partners. Critical areas of focus for the EOC have been establishing a unified incident command structure designed to enable effective and efficient response management, establishing plans to address COVID-19 related needs, namely hospital surge and testing needs and recovery, coordinating and managing resource requests, and establishing a joint information center to provide timely, clear, and consistent messages to the public, stakeholders, and the media. These efforts and the efforts of the community as a whole flattened the curve and have positioned us well. This is a moment for all of us to reflect on the progress that we have made and the lessons we have learned, and to recommit ourselves to doing everything we can to save lives. The transmission of COVID-19 remains a significant threat to the health and safety of Washington County residents. Although Washington County has not been impacted as gravely as other areas of Maryland and the United States, we have taken notice of slight upticks in a few of our key indicators. As expected, our new infections have continued to rise, but not without any significant spikes or anything concerning, just a steady rise. However, our positivity rate, which is the percentage of specimens that test positive, has begun to rise slightly. Positivity for Washington County was 4.7% in early June and steadily declined to 1.4% on July 5th. As of today, it has unfortunately increased to 2.9%. Additionally, our effective reproduction number, or R value, is currently 1.02. This value signifies the average number of people that one infected person will pass the virus to. Simply put, the value is an indicator of how many people one infection or one infected individual will spread it to. Early on in the virus, it was 2 to 3. And this value, even at a level that is slightly higher than 1, indicates that there's continued viral spread, which could lead to an exponential growth in cases. We need to get this number under 1. We have already learned a lot about this virus, and although there's still a lot we don't know, we do have effective measures to implement. Scientific evidence shows that wearing a face covering and social distancing reduce the transmission of virus. Other than mandated stay-at-home orders, these are the most effective ways to slow viral spread. We all need to do everything we can to limit the spread of COVID-19. Until we have a vaccine and expanded treatments, wearing a face covering and social distancing are key and critical measures. Pandemic fatigue is real. We all know this, and the frustration is understandable. But now is the time to take proactive measures to focus on our families, friends, neighbors, and community. Not only has the virus had a detrimental impact on the health and well-being of our citizens, but it has also wreaked havoc with our economy. Since the stay-at-home order has been lifted, social distancing limits loosened, and we continue to reopen, it is up to each of us to be responsible and heed the advice being given. We must change the current dynamic of lackadaisical wearing of face coverings and physical distancing. If community action is not taken by all of us, the spread of this virus will continue to intensify, will continue to spread throughout the community, and our daily lives very well could be impacted again. If we do not take these very simple steps, wear a face covering, physical distance, we may end up where we started, with business closings, which in turn have a devastating effect on families and on our ability to earn a living. So I say, this is not only the right thing to do for the health and safety of our community, it's also good for business. We owe it to our community to ensure that those that do go out can have the confidence in knowing that the businesses they are patronizing and the people that they are encountering while they're out are looking out for their best interest. I am strongly reminding everyone that under Governor Hogan's current orders, it is required, not recommended, it is required that face coverings be worn in these situations. For customers over the age of 9 in any retail establishment or food establishment. And additionally, any adult customers accompanying children under the ages or between the ages of 2 and 9 must be responsible to take reasonable efforts to have their children wear a face covering while inside any of those retail or food establishments. Also, for staff and employees in all retail establishments while working in areas open to the general public and areas in which interactions with other staff or employees are likely. For staff and employees in food establishments who interact with customers, including delivery personnel. Riders and operators on public transportation, all staff and employees of alcohol manufacturers or manufacturing or sales establishments, personal services, inclusive of salons, tanning, tattoos, and massage parlors, indoor and outdoor sports activities when feasible, youth camps when feasible, and swimming pools when feasible. In these settings, face coverings are required per the governor's order. In addition to the requirements of the executive order, it is strongly recommended that face coverings be worn outdoors when physical distancing of 6 feet or more is not possible. In addition, I am strongly reminding businesses that under Governor Hogan's current orders, they are required to, in good faith and to the extent possible, designate with signage, tape, or by other means at least 6-foot spacing for persons in line. Sanitize or provide customers with the means to sanitize handles of carts and baskets that are available to customers. Provide staff and customers with clean restrooms with soap and sanitizer, and allow staff to wash their hands at least every 30 minutes. And finally, post signage at each entrance advising customers about the requirement to wear face masks as was described above. To be clear, businesses, facilities, organizations, and establishments that do not comply are subject to investigation, which could result in a modification of operations and/or closure. And the closure remains in effect for the remainder of the governor's declared state of emergency. Although face coverings and social distancing are our primary efforts, everyone, and I mean everyone, should also continue to wash your hands before leaving and returning home as much as possible. Use hand sanitizer that is at least 70% alcohol when hand washing is not possible. If you are sick, stay home and away from others, and avoid touching your nose and face. Also, it is strongly recommended that everyone continue to follow the most current guidance from the Centers for Disease Control and Prevention and from the Maryland Department of Health regarding physical distancing, which includes the avoidance of large gatherings in crowded places. As a community, we are empowered. Every one of us must understand that the things that we do and the things that we don't do have an impact on other people. Our health and the community's health is in our hands. As I've outlined, these include physical distancing, hand hygiene, covering coughs, staying home if you're sick, and wearing face coverings. You may be in a low-risk category, but the choices you make could be the difference between life and death for someone else. We cannot wish this virus to go away. It's here for the duration, for the long haul. But what we can do is implement preventive measures that we know work. We are all in this together, and the widespread and combined use of face coverings and social distancing is the most effective way to keep the economy open and keep the community as safe as possible. Addressing this emergency will obviously take a sustained effort by everyone involved. We will get through it together, but everyone must take this threat seriously and heed the recommendations of public health experts and healthcare professionals to adhere to the guidance put in place by CDC and the Maryland Department of Health. In closing, I would like to thank our dedicated public health experts, public relations staff, and healthcare and emergency planners for their tireless work. I would also like to thank the many healthcare professionals and first responders for putting their health at risk to keep everyone safe. Additionally, I would like to thank everyone in the community for your cooperation and for doing your part to keep your family and the community safe. In closing, we're faced with, in my estimation, two critical questions that each of us must answer. And they are, will we stand in solidarity with our community? And will we do everything possible, everything within our power, to protect the health, safety, and economy of the community we love? Wear a face covering, watch your distance, and wash your hands. If we don't take control of the virus will take control of us. Thank you. With that, I would like to bring up Dr. Mullik Joshi from Meredith Medical Center.
Thank you very much, Earl. Good afternoon, everybody. I want to first just say thank you to Earl Stoner, the health department, and the county for their incredible leadership during this pandemic time. As both a partner and a resident, I can only tell you how much appreciative I am of their leadership and what the county should appreciate in terms of incredible dedication and focus. We are prepared, as you just heard from Earl. We are continuously prepared and continuously working towards crushing this curve. We monitor on a daily basis key indicators that you can see on the website. We look at hospitalizations at the Meredith Medical Center. We look at people in the ICU. We look at those on ventilators. We look at deaths. And we monitor our personal protective equipment supplies so that we can keep everybody safe, our healthcare heroes and our patients. So far, we've done really well as a community. We've been in the green mostly, with some yellows that we monitor very, very closely. But it's an ongoing daily focus to ensure we have the PPE and ensure that we're taking care of everyone that we see. Testing, as you all know nationally, is a major issue, both from all of our perspectives. Providing frictionless, easy access to testing to the members of our community is absolutely critical to know the prevalence of COVID-19 and how we can control any spread. We have, as a county, done over 20,000 COVID-19 tests. That is one of the highest in the state of Maryland of any county based upon population size. We have a low prevalence rate, but everything that is happening nationally has impacted us. As you all read about supplies and the challenges we have, that impacts us locally as well. So as you know, testing has become a mainstay, but has also increased dramatically. We have in our one site in Creighton Boulevard gone from about 100 to 200 tests a day to over 300 tests a day now. So we continue to look at ways to streamline the process, make it easier, and make it convenient for our community members. And we appreciate all of you as we work through these issues with the national impact on our supply disruption. Finally, as Earl said, I cannot say enough about staying vigilant. Wash your hands, wear a mask, and social distance. These are the three knowns that will get us to where we need to beyond this pandemic. I want to say thank you again to the county, to our healthcare heroes. And as Earl said really well, there are a lot of unknowns with COVID-19, and we will have those, but we are prepared as a community in partnership with all the key players to make sure we are ready and proactive in addressing those issues. But the knowns we do know, and those are wash your hands, wear a mask, and social distance. We as a community must be vigilant in doing those three things. Those are the preventive bundle to get us to where we need to. So I appreciate the opportunity again. Thank you to the county, and thank you to all our residents to say keep doing what we're doing in terms of those preventive measures. I'll now turn it over to Susan Small, Director of Business Development for Washington County.
Good afternoon, and thank you very much, Dr. Joshi, and Earl as well. I'm here to provide a very brief update for you on the Washington County Rise Up Business Stabilization Grant, which is part of the fund from the Federal CARES Act. The COVID-19 Small Business Emergency Relief Business Grant was designed to offer working capital to assist small businesses in Washington County with disrupted operations due to COVID-19. Grants for up to $10,000 have been awarded to Washington County businesses with qualifying financial stress or disruptions due to impacts related to COVID-19 pandemic. To date, Washington County has received approximately 675 applications. Of those received, we have been able to review and approve over 375 of those, totaling more than $4.2 million in grant awards. Many applications received are still in process, as the total funding was $8.96 million. So if you have applied and you haven't received an award letter, we just want to thank you for your patience, as it does take a little time to get through the process, but you are more than welcome to reach out to us anytime at riseup@washco-md.net. We will continue to accept applications through July 20th. And you can find the application along with guidelines and an informative FAQ sheet on our website at washcorises.net. I also want to take a brief moment to thank our businesses in the county who have continued to be proactive to take the necessary steps to protect their staff, their customers, and themselves during the recovery phase. We understand that these are very trying times, and the Washington County Department of Business Development is committed to working closely with our businesses, our business partner organizations, and the health department to stabilize our local business community. Please continue to protect yourself and those around you by practicing proper social distancing, wearing masks, washing hands, as we continue to make the economic and health recovery in Washington County. Lastly, I just want to make everyone aware that we have signs available. You can download them, print them, hang them on your door for businesses, for your customers, showing exactly before you enter what your occupancy levels are and proper sanitation. So if you'd like, you can reach out to us. We're happy to print them and deliver them to you if you need them for your business. Again, thank you so much, and Thank you.
Okay, and with that, we will entertain any questions that people may have.
Julie Green with the Herald Mail. You mentioned a whole bunch of rules, situations in which people have to wear masks. Are there specific things you're seeing in the community that you find worrisome?
The biggest is that we see a large number of individuals who aren't wearing a mask at all, and a pretty significant amount of individuals who are wearing the mask incorrectly. You have like, it's not a chin strap, it's a face mask, and it needs to go over your nose and also cover your mouth. They're the two biggest things.
Okay. Have there been any gatherings or events that have given you pause or led to known COVID spread in our community?
We aren't aware of any large gatherings that have been connected with any cases or any clusters. To be quite honest and candid with you, any large gathering gives me pause at this point. Obviously, we don't have a gathering restriction per the governor any longer, and it's still critically important that people, if they can, avoid large gatherings, appropriately physical distance, and try to avoid crowds. But any large gathering gives me pause at this point.
How are you defining large gathering?
Anything really significant. I mean, I can't necessarily put an actual number on it, but when you're looking at large gatherings for events, people going out to festivals, people going out to any carnivals, anything of that nature.
Have you had to modify or close any businesses or facilities at this point?
We have not had to modify or close any businesses to this point. We've had one business voluntarily closed that we had been working with.
Which was that?
Hagerstown Speedway.
Okay. Can you give us an update, or maybe Mr. Joshi, on the status of PPE for public health in the community, such as Meredith's network and first responders? Just the supply situation?
In particular, specific to the community, I mean, PPE has been and continues to remain sort of like one of the, I wouldn't say obstacles, but one of the sort of supply chain issues that we face in this response. From the standpoint of having sufficient amount of PPE for the community's perspective, if you're looking at it from a week or two supply, we're fine. And we have continued to maintain that. Dr. Joshi can speak for Meredith, but it's always a concern that's in the back of your mind, especially as we see the impact that the surges across the country are having with testing equipment in the supply chain. An already tested and an already fragile PPE supply chain, certainly disrupting that wouldn't be something that we would like to see.
Thank you, Earl. Yes, absolutely. It is a constant concern. We are in the green and have enough for a couple of weeks in every major supply, but it's something we work on every single day, and our national system is fragile, and so we are constantly trying to secure more across the board, from gowns to gloves to cleaning solutions, everything.
But your staff has enough. Is there like a time frame that you have enough for now?
It varies by different supply, but we definitely have enough for at least 3 weeks on everything. But again, that's all based on current usage and current patterns withstanding any spikes.
Is that just the hospital you're talking about?
The hospital and all our medical practices, and Earl could speak to beyond the community.
As far as you know, the supply, how long it would last for the first responders?
I don't actually have that number right here in front of me, but we have enough for a couple weeks easily. We are in a similar situation to Meredith in that, I say we go week to week, but really over the course of about a 3 or 4 week period, we know that we have enough with current response activities now. As Dr. Joshi brought up, no spikes, but we're comfortable where we are. But again, that's dependent on that replenishment of supplies. I say 3 to 4 weeks, but we're working on a system where you have a 4 week supply and you get a week into it, you need to be replenishing that week. So even though we have 4 weeks, that doesn't necessarily mean that we won't have issues with the supply chain at some point. But we're comfortable, we're fine right now.
As far as the supply chain, I mean, are you comfortable in being able to refill it, or you're not?
As I stand here today, I'm comfortable being able to refill it. But unfortunately, in the times that we're in with this pandemic, it really is only a phone call away or literally a missed shipment away. You know, you can expect to get a shipment in, say, on a Monday, and you don't necessarily get any call from the manufacturer that it's not coming in. So fortunately, from a PPE perspective, we've been able to acquire enough through the state and also through private manufacturers to maintain a pretty comfortable level.
And maybe you both could also address the next question. I understand it's taking longer to get the test results back. And Dr. Fauci recently said that if it's taking like 5 to 7 days to get a test result back, what's the point in even doing contact tracing?
Yeah, I would like Dr. Joshi to.
So this is a challenge, and again reflects the challenges we have nationally with our supply. So currently, Meredith's Medical Lab conducts all up to its capability based upon the solution supply that we get. We get enough, as Earl just said, on a week-to-week basis. So that can change as well, again, out of our control. So we prioritize Meredith's Medical Lab doing all the patients that are in the hospital and at the highest risk. Other tests are being sent out now to a third-party lab. Previously, their turnaround times were 3 to 5 days. They're now upwards of 10 days. And again, out of our control, but we continue to stay focused on that. We want to provide easy access to the test. The results is a challenge.
And you don't see a solution to that in the near future?
The federal government, everybody's trying to work on a solution. You know, as you probably have seen nationally, there are 10, 12-hour waits to get this. We don't have that, but it is a challenge. And I think we're all working on different machines, different ways, but it's being able to get the information, get the supplies, that's the key piece.
How long are people having to wait just to get the test?
At the Creighton Boulevard, I can say it's been generally an hour, but it's obviously gone up when we have a big bolus of people coming like Monday mornings or other times. We've essentially increased 50% more people getting tests over the last week.
Thank you.
All right, so this goes with the mask mandate and such. So what do you have to say to people who claim that they can't wear masks due to medical exemptions?
Well, anybody who has a medical reason in particular that would preclude them from wearing a mask, obviously we don't want to put them in a situation where you know, they could have a recurrence of, you know, whatever issue that they have or have trouble breathing or anything. I would say that for anyone that is capable of wearing a mask, it's critical to wear a mask. I should say facial covering, not necessarily just a mask. But there are exemptions for individuals who have you know, ADA or medical issues that would preclude them from wearing that.
Gotcha. And then this is also going along with Meredith and testing. So I know that Meredith has closed at least one of its testing sites so far. So do you expect more testing centers to open back up as students return to school in the fall?
We are planning for additional ways to get more people through, especially with the fall coming. So we are looking at additional testing site. We're looking at other hours. We're looking at all those options right now. The supply still being a problem in that we can test more people, but we're dependent upon our third parties at this stage.
Gotcha. All right, that's all my questions.
Follow up on the mask wearing. I know that the state police and I guess other law enforcement are charged with enforcement, but if people aren't going to wear masks, a lot of businesses and folks are sort of, you know, having to ask folks to wear masks. How do you deal with like you said, the lackadaisical attitude or the unwillingness to wear them?
As it relates to a business? Or
Business? Yeah.
well,
Sure.
you know, as I mentioned, I mean, it's required you're required to have a mask to go into any retail or food establishment, and in the other areas that I mentioned. It is incumbent upon those business owners to make sure that they are following the executive order and requiring individuals that come in to wear a mask. If individuals refuse to wear a mask and get unruly and aggressive, they can call law enforcement because then once they ask that individual to remove themselves from the premises and they don't do that, then it becomes a trespass issue.
Are you aware of any such incidents in the local community?
I am not aware of anyone being charged in relationship to not having a face mask on. I am aware of many instances where, law enforcement has had to, be involved, and the health department has had to be involved, but I'm not aware of anyone who has been charged thus far.
Thank you.
Thank you, guys.